The term level of consciousness refers to a person's awareness and understanding of what is going on around him or her. Consciousness is classified into three distinct levels: conscious, decreased consciousness, and unconscious. In this scenario, the patient has severe drowsiness. He or she can be aroused by moderate stimuli, but then drifts back to sleep.
Hi ma'am, I am Jacqueline, your nurse for today. May I ask you a simple question? Is that okay? Ma'am, what is your name po?
Hello, my name is Tricia Santa Cruz.
Okay. Your address, ma'am?
I'm from Santa Rita, Pampanga.
Last question na lang po, ma'am. Your phone number po?
My number is 0922-775683.
Okay. Thank you, ma'am.
In this scenario, the patient is in a state similar to lethargy, in which the patient has a lessened interest in the environment, slowed responses to stimulation.
Hi, ma'am. I am Jacqueline, your nurse for today. Can you tell me your name, ma'am?
My name is Tricia Santa Cruz.
In this scenario, the patient will only respond to vigorous and repeated stimuli. And when left undisturbed, the patient will immediately lapse back to the unresponsive state.
Hi ma'am, my name is Mariel Tulagan, your nurse for today. Can you tell me your name and what year and month it is?
We'll take note of all the responses.
In this scenario, the patient is in a state of unarousable unresponsiveness.
Hi ma'am, my name is Aline T. Cambao, your nurse for today. Can you tell me your name? Can you tell me what year and month it is? Can you tell me where you are?
Shown here is the tool used to assess the level of consciousness of a patient, which is the Glasgow Coma Scale. This tool is used at the bedside in conjunction with other clinical observation, and it allows us to have a baseline and ongoing measurement of level of consciousness for our patients.
The technique of evaluation of the patient with an altered level of consciousness can be divided into three phases. First is to determine the level of consciousness itself. Second is the evaluation of the patient, searching carefully for hints as to the cause of the confusion or coma. Third is the presence or absence of focality of the disorder, both in terms of the level of dysfunction within rostrocaudal neuraxis and specific involvement of cortical and brainstem structures.
It is important to exclude the possibility that the patient is asleep before proceeding to assess eye opening.
Hello, Miss Shandy.
In this scenario, spontaneous eye opening is recorded since the patient is observed to be awake with her or his eyes open as the nurse enters the room. This observation is made without any speech or touch. Spontaneous eye opening is allocated a score of 4.
Hello, Miss Shandy. Hello, Miss Shandy. Hello, Miss Shanli. Miss Shanli. Hello.
Eye-opening to speech is recorded in this scenario since a patient opens her or his eyes to the loud, clear commands of the nurse. Eye-opening to speech is allocated a score of 3.
Hello, Miss Shanli. Hello, Miss Shanli. Hello, Miss Shanli.
Eye-opening to pain or pressure is recorded in this scenario since a patient opens her or his eyes to a painful stimulus. Fingertip pressure and supraorbital ridge pressure are the two most commonly used methods. Eye-opening to pain is allocated a score of 2.
Hello, Miss Shanli. Hello, Miss Shanli. Hello, Miss Shanli.
A recording of none shall be made when no response to a painful stimulus is observed. A complete lack of eye opening is given a score of 1. Remember that a patient with flaccid ocular muscles may lie with her or his eyes open all the time. This is not a true arousal response and should be recorded as a no eye opening response and allocated a score of 1. Such a response should not be documented as spontaneous eye opening. If a patient has an endobrachial Q-tube or tracheostomy tube in situ, this is recorded as P on the chart under no response and allocated a score of 1. If a patient is dysphagic, the best verbal response cannot be determined with accuracy. This is recorded as a D on the chart under no response and allocated a score of 1.
Can you tell me your name?
I'm Rufame Santos.
Can you tell me what year and month it is?
It's March 17, 2022.
Can you tell me where you are?
I'm in Our Lady of Mount Carmel Medical Center.
This person is orientated to time, place, and person. This would score 5.
Can you tell me your name?
Rufame Santos.
Can you tell me what year and month it is?
It's March 17, 2022.
Can you tell me where you are?
I don't know. Am I at home? Is this my home?
This person is classified as confused since one or more of the above questions are answered incorrectly. A patient who is confused is allocated a score of 4.
Can you tell me your name?
No! Get out of my house. I don't want to see you.
This person is classified as using inappropriate words. Conversational exchange is absent and she or he tends to use single words more than sentences. Swearing is also common. A patient who is using inappropriate words is allocated a score of 3.
Can you tell me your name?
The person's response cannot be understood. It is made up of sounds rather than words and does not form an answer to the question to ask. These will score 2.
Can you tell me your name?
This person fails to make any response to the question. A recording of none should be made when the patient does not respond verbally to verbal or physical stimuli. A lack of verbal response is allocated a score of 1.
Hello, Miss Rupa. Can you stick your tongue out for me? Okay. Now can you lift your right arm for me? Okay.
The nurse was able to get the patient to follow a simple command such as sticking tongue out or lift up the right arm. If the patient obeyed command, it would be scored 6.
Miss Rufa, can you stick your tongue out for me? Miss Rufa, can you stick your tongue out for me?
To be classed as localizing to pain, the arm must raise above the nipple height towards the painful stimuli. This would score 5.
Miss Rufa, can you stick your tongue out for me?
The patient's arm responds to the painful stimuli but in a less purposeful way and does not go above the nipple height, so is to be classed as flexion. This would score 4.
Miss Rufa, can you stick your tongue out? Miss Rufa, can you stick your tongue out?
The nurse will have a difficult differentiation to make. If it does not look like normal flexion, it is abnormal. The abnormality can include the movement of both arms abnormally. This is very rarely seen. This would score 3.
Miss Rufa, can you stick your tongue out? Miss Rufa, can you stick your tongue out?
The patient's elbows are locked straight, their wrists are flexed, and their shoulders are internally rotated. This movement is indicative of a very serious neurological disorder. This will score 2.
Miss Rufa, can you stick your tongue out for me? Miss Rufa, can you stick your tongue out for me?
The patient makes no movement and there is no motor response at all. This would score 1. The lack of movement can be indicative of extremely serious neurological disorder or death. For example, if we are informed a patient has a GCS of 15 out of 15, we will not necessarily need to arrange an emergency transfer. However, if a patient had a GCS of 8 out of 15, we will need an anesthetist to review the patient prior to an emergency transfer. In this case, we will also have a surgeon waiting to accept the patient on arrival to potentially take them straight to theater and make other necessary preparations.